Hi friends, in this session we will be discussing the simple topic that is, read the question first. Most commonly affected nerve in carpal tunnel syndrome. Well, that is our topic, carpal tunnel syndrome. We will talk about it and then we'll try to solve the question, right? What is the definition of CTS? Carpal tunnel syndrome, it is a compression of the median nerve within the carpal tunnel at the wrist. So, see, at this wrist region, okay, we have a space, okay, and the base and the sides of that space, it is formed by carpal bones, okay, and the roof, it is formed by flexor retinaculum. I think it is very clear here. Shall I make the picture a little big? So you can see, you can appreciate this roof here, right? That is a flexor retinaculum, which is also called as transverse carpal ligament. That is strong fibrous tissue. Okay, and at the sides and at the bottom we have got wrist bones, that is carpal bones. Okay, and we have a space formed by these structures inside, and that space, it is called as what? Carpal tunnel. This much clear? Okay. Now this carpal tunnel has got structures inside. Okay, you can appreciate there are some structures right here inside. So we'll talk about that. The main structures are, we have a nerve there, this yellow color, right? That nerve in the carpal tunnel, അതിനെയാണ് ഞാൻ median nerve എന്ന് പറയാം. Median nerve. See the second picture. Okay, if you're cutting the hand like this and seeing it from this side, this is how it looks. Appo sideilum bottomilum carpal bones under. Mele you can see this is a fibrous band, that is a flexor retinaculum, and inside, okay, this, one second, huh? Can you guys see properly now? Yes. And inside that space you can appreciate the green color. Okay, green color, small round structures you see are the tendons. I'll tell you, tendons. And this yellow color here, that is a nerve. Which nerve? Median nerve. So this point is what you should learn from this class. Carpal tunnel nada, which nerve is running? It is a median nerve that is running from the forearm into the palm. Okay, fine. Once again. Oh, did I miss a PPT slide? Okay, so what are the, yeah. Okay, so the contents, we have got median nerve and we have got the tendons of flexor muscles. So നമ്മുടെ forearm anterior compartment, okay, this is a forearm, right? So forearm and this part, that is the anterior compartment of the forearm. ഇവിടെ നമുക്ക് എന്ത് muscles ഉണ്ടാവും? We have got muscles called as flexor muscles. Okay, FDS, FDP, FPL. Can you tell me what these are? Flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. Okay, about muscles they are here in the anterior compartment of the forearm, and muscles, the tendons, they are passing through this carpal tunnel towards the palm. Okay. Now, why are they called as flexor muscles? Why the muscles in the picture are not at the slide la njan include cheyidekkunna. See, can you appreciate, this is a forearm, okay, this is a forearm, okay, and you can see, okay, this muscle here, right, that is FDP, and this muscle here, this one, that is FPL. There was one more. Okay, just two pictures I've got. Fine. So why are they called as flexor muscles? They are called as flexor muscles because they help in flexion. Flexion of what? These muscles, okay, based on their insertion, they help in the flexion of the wrist. These muscles, they help in the flexion of the metacarpophalangeal joint. idana metacarpophalangeal joint. Okay, and these muscles, they help in the flexion of the proximal interphalangeal joints. These muscles, they help in the flexion of the distal interphalangeal joints. So obviously ഒരു മസിലിന് ഓരോ ഫംഗ്ഷൻ ഉണ്ട്. ഞാനത് കളക്റ്റീവായിട്ട് പറഞ്ഞാണ്. Anyways, all these three muscles, when they contract, it helps us to flex the wrist or this part or the fingers. Okay. Now remember that this FDS, okay, it has got 4 tendons. Okay, it enters the palm from the forearm and it has got 4 tendons. Okay, FDP also has got 4 tendons. FPL has got 1 tendon. So totally എത്ര tendons ആണ് ഈ carpal tunnel കൂടെ പാസ് ചെയ്യുന്നത്? Totally 9 tendons are passing. Okay, along with the median nerve. This much clear? Fine. Now, okay, now why this carpal tunnel syndrome occurs? See, this is a space. Carpal tunnel endana, it is a space formed by the bones and the fibrous band, flexor retinaculum. Now, when these tendons, totally etra tendons are 9 tendons are there inside. Okay, and it is a small space. So due to some reasons of these tendon sheath get inflamed, what happens to the space? Our space, it gets filled up. And this causes compression of the median nerve. Okay, അപ്പോൾ ഈ ടെൻഡൻസിന് ചുറ്റിനും എന്തുണ്ട്? ടെൻഡൻസിനെ കവർ ചെയ്യുന്ന സ്ട്രക്ചർ ആണ് ടെൻഡൻ ഷീത്ത് എന്ന് പറയും. So all these tendons, they have got tendon sheath around it. It is a covering of tendons. Okay, so basically tendon sheathന്റെ മേലെ നമുക്ക് synovial fluid ഉണ്ട്, and because of the synovial fluid, when these tendons are moving, lot of tendons are there, no? When these tendons are moving, there is no friction between the tendons. The synovial fluid keeps them happy. Okay, so as we move, as we flex different parts of the hand, the wrist, there is no much friction happening between the tendons and they work well. Okay, so due to some reasons, okay, it could be pregnancy, rheumatoid arthritis, diabetes mellitus. So most of these reasons that I've listed here, okay, what happens? They cause the inflammation of the tendon sheath. Okay, now when already 9 tendons under, when these get inflamed, what happens? It is a small space also, the carpal tunnel. So the median nerve, there is a chance that median nerve can get compressed. Understood? Okay, so repetitive wrist movements, same thing, irritation to the tendon sheath, they can get inflamed. Diabetes mellitus, pregnancy, rheumatoid arthritis, same thing. All of these eventually can cause inflammation of the tendon sheath. Now, hypothyroidism. See, hypothyroidism also, the final pathology is inflammation of the tendon sheath. But few points about hypothyroidism. See, but it leads to a condition called as myxedema. What is myxedema? The swelling of the tissues due to hypothyroidism, it is called as myxedema. അപ്പോൾ ഈ ഒരു കണ്ടീഷൻ ഉള്ള ആൾക്കാർ, their skin, അവരുടെ ഫേസിലെ സ്കിൻ, it gets puffy. Can you tell me why? അവരുടെ കണ്ണിന് ചുറ്റിനും there is going to be periorbital edema. Why? See, in hypothyroidism, glycosaminoglycans, okay, that gets deposited in tissues. Okay, in short form we call it as GAGs, GAG, small letter S, GAGs, glycosaminoglycans. Okay, appo endha ee sambhavam GAGs endha, what is it? They are nothing but sugar chains. They are sugar chains. appo ee sugar chains tissues il deposited out. Okay, body ide pala tissues il deposited out in hypothyroidism. Okay, now these sugar chains, they are in love with water. So you know what they do? They will attract water and this will cause a swelling of the tissues. അതുകൊണ്ടാണ് ഹൈപ്പോതൈറോയിഡിസത്തിൽ ഡിഫറെൻറ്റ് പാർട്സിൽ സ്വെല്ലിംഗ് ഉണ്ടാകുന്നത്. ഓക്കെ, their സ്കിന്നിനകത്ത് ഗ്യാസ് ഡെപ്പോസിറ്റഡ് ആവാം. So skin becomes puffy. Same with the eyes. Even in the tongue, it can cause swelling in hypothyroidism, which is called as macroglossia, right? Similarly, same thing. What in the tendon sheath also, carpal tunnel le tendon sheath ilum glycosaminoglycans deposited avam, and this can cause what? Swelling of the tendon sheath, which can compress the median nerve in the carpal tunnel. Understood? Okay, so yeah. Causes പഠിച്ചു. Clinical features എന്താണ്? What will the patient tell you? Patient says, ഡോക്ടറെ കൈയിൻ്റെ lateral 3.5 part. Lateral 3.5 part എന്ന് പറഞ്ഞാൽ എന്താ? Thumb, the first finger, I mean not the first finger, the index finger. Index finger, which finger is that? See, anatomically, നമ്മൾ thumb ആണ് first finger എന്ന് പറയാം. Then we count it like this: first finger, second finger, third finger, fourth finger, fifth finger. Okay. അപ്പോൾ when the median nerve is compressed, you know what happens? Thumb, index finger, middle finger, and half of the ring finger. This area, this much area, it is going to be affected. Okay. അപ്പോൾ ഈ ഭാഗങ്ങളിൽ ബിക്കോസ് ഓഫ് ദി ഇറിറ്റേഷൻ ഈ ഭാഗങ്ങളിൽ മീഡിയൻ നെർവ് സപ്ലൈ ചെയ്യുന്നുണ്ട്. അപ്പോൾ ബിക്കോസ് ഓഫ് ദി മീഡിയൻ നെർവ് ഇറിറ്റേഷൻ ഓർ കംപ്രഷൻ, ദ പേഷ്യൻ്റ് ഇസ് ഗോയിങ് ടു സേ, ഡോക്ടർ ഐ ഫീൽ നവ്നെസ് ഇൻ ദിസ് പാർട്ട് ഓഫ് ദ പാം. ഓക്കെ. ആൻഡ് നെക്സ്റ്റ് ഫീച്ചർ ദിസ് ഈസ് നൈറ്റ് പെയിൻ. രാത്രിയാകുമ്പോൾ ഈ ഭാഗങ്ങളിൽ ഓക്കെ ദർ ഇസ് ഗോയിങ് ടു ബി പെയിൻ. യു നോ വൈ? ദർ ആർ ഫ്യൂ റീസൺസ്, നോട്ട് ജസ്റ്റ് വൺ. But most importantly, രാത്രിയാകുമ്പോൾ when they sleep, these people by mistake they might flex their wrist and sleep. Okay, ഉറങ്ങുന്ന സമയത്ത്. അപ്പം അങ്ങനെ ഉണ്ടായാൽ ഓൾറെഡി കാർപ്പൽ ടണൽ സിൻഡ്രോം കാരണം മീഡിയൻ നെർവ് കംപ്രസ്ഡ് ആണ്. അപ്പോൾ റിസ്റ്റ് ഫ്ലെക്സും കൂടെ ചെയ്ത് വെക്കുകയാണെങ്കിൽ the nerve is going to be more compressed and the patient is going to feel increased symptoms. Okay. So sensory clinical features ഇതാണ്. മോട്ടർ എന്താ? What are the motor features? See, this median nerve, it supplies the thenar muscles. Okay, this ividulla muscles are thenar muscles. And since the nerve is compressed, these muscles are going to get atrophied. They are going to become weak. Okay, and also this median nerve is very important for opposition. What is opposition? That is when I move my thumb against the other fingers, it is called as opposition. അപ്പോൾ എനിക്ക് അങ്ങനെ ചെയ്യണമെങ്കിൽ എൻ്റെ മീഡിയൻ നെർവ് നോർമൽ ആയിരിക്കണം. കാർപ്പൽ ടണൽ സിൻഡ്രത്തിൽ മീഡിയൻ നെർവ് ഇസ് നോട്ട്, ഇറ്റ് ഈസ് കംപ്രസ്ഡ്. സോ ദ പേഷ്യൻറ്റ് വിൽ നോട്ട് ബി ഏബിൾ ടു ഡു പ്രോപ്പർ ഒപ്പോസിഷൻ ആൻഡ് മോസ്റ്റ്ലി ഹിസ് തംബ് വിൽ ബി വെരി ഫ്ലാറ്റ്. ഓക്കെ, ജസ്റ്റ് ലൈക്ക് ദിസ്, ലൈക്ക് എ monkey's hand. Okay, and this leads to ape thumb deformity. Okay, a monkey's thumb looks like this. Monkeys in their thenar muscles. Oh, before that, actually thenar muscles ആണ്, they help us in opposition. നമ്മുടെ തമ്പ് വെച്ച് ബാക്കി ഫിംഗേഴ്സിൽ നമ്മൾ മുട്ടിക്കണമെങ്കിൽ it is because the thenar muscles are working very well. Okay, and thenar muscles are supplied by median nerve. Monkeysൽ അവരുടെ thenar muscles are not very well developed, so അവർക്ക് opposition അത്ര പ്രോപ്പറായിട്ട് ചെയ്യാൻ പറ്റില്ല. ഈ carpal tunnel syndrome ഉള്ള ആൾക്കും because of the median nerve compression, thenar muscles are getting weak. Patient will not be able to do this action, so mostly he keeps his hand like this, finger, thumb like this. That is why we call it as ape thumb deformity. Okay, this much understood? Okay, fine. Okay, now the important signs. See, CTS la we do something called as Fallon's test. Fallon's test എന്താണെന്ന് പറഞ്ഞാൽ നമ്മൾ പേഷ്യൻറ്റിനോട് we ask him or her to flex the wrist. This is a flexion of the wrist. അല്ലേ, ഇങ്ങനെ ചെയ്യുമ്പോൾ what happens, നമ്മൾ ആ കാർപ്പൽ ടണലിനെ കുറച്ചും കൂടെ ആ സ്പേസിനെ നാരോ ആക്കുകയാണ്. അപ്പോൾ മീഡിയൻ ഓൾറെഡി കംപ്രസ്ഡ് ആണെങ്കിൽ when you're doing this action the symptoms are going to be increased. Okay, so Fallon's test is wrist flexion causes increased symptoms. Understood? Tunnel sign എന്താണ്? Tunnel sign is you tap along the distribution of the affected nerve. നമ്മളിങ്ങനെ ഈ ഭാഗത്ത് ടാപ്പ് ചെയ്തുകൊണ്ടിരിക്കുക. അങ്ങനെ ചെയ്യുമ്പോൾ see already the nerve is compressed. So when you are tapping that area, it sends altered signals to the parts that it supplies, and the patient is going to say, doctor, I'm feeling numbness, pain over this area. Okay, that is tunnel sign. Alright, so ഈ രണ്ട് സൈൻസും ഇമ്പോർട്ടൻ്റ് ആണ്. അപ്പോൾ ഇതാണ് ഫാലൻസ് ടെസ്റ്റ്, ഇമ്പോർട്ടൻറ്റ് ഫോർ യുവർ നീറ്റ് PG FMG. ഓക്കെ, അവർ ഇമേജ് ബേസ്ഡ് ക്വസ്റ്റ്യൻ ആയിട്ട് തന്നിട്ടുണ്ട്. ഇത് ഈ ഒരു പിക്ചറിൽ കാണുന്നതാണ്. This picture, it shows you tunnel sign, tapping over the median nerve, that is tunnel sign. And the next picture shows you Fallon's test. Okay, investigation, we want to see how the nerve is working there, if it is compressed or not. We do a nerve conduction study that will confirm the diagnosis. And management, see, first you tell the patient, suppose he does a lot of repetitive movements, he does a lot of typing, you tell the patient take rest. Conservative treatment, we give them Risplin's, painkillers. And if the pain is not subsiding, then we can go for, or the symptoms are not subsiding, then we can go for surgical decompression. Okay, ഇവിടെ നമ്മൾ എന്താ ചെയ്യുന്നതെന്ന് വെച്ചാൽ we cut the flexor retinaculum, the roof, so that the space is not very narrow. There is increased space for all the structures to pass, and the median nerve is no more compressed. Understood? അപ്പോൾ ഇത്രയാണ് ഇമ്പോർട്ടൻറ്റ് പോയിന്റ്സ് അബൌട്ട് കാർപ്പൽ ടണൽ സിൻഡ്രോം. Can we read the question again? Yes. Most commonly affected nerve in carpal tunnel syndrome. I'm sure you guys know the answer. The answer is median nerve. So if you want to remember in the exam, sometimes you get confused even if you learned everything. So remember, tunnel has got N. Okay, N. After N comes M. Okay, so this M is for median nerve. All right, so that is it. I'll see you all in the next class. Take care. God bless you. Bye bye.